Hi, my name is Michelle.
And I'm Megan, and our project title is Does Private Room Occupancy Have Any Effect on the Overall Wellness of Patients?
Hospital facilities are forever changing in order to better serve their patients. One of the most common problems in the hospital setting is the spread of infection. In order to address this problem and decrease the number of nosocomial infections, new construction hospitals are beginning to use private rooms for all patients. As stated by the Facility Guidelines Institution, it is a requirement for all new construction hospitals to implement private rooms for future patients. Though research is done in the past, the Facility Guidelines Institute added this guideline for hospitals to abide by the year 2006. This research study plans to explore the subject of the private rooms versus semi-private rooms and to determine an answer to the research question. Does private room occupancy have any effect on the overall wellness of patients? In older hospital, private rooms are lacking entirely, or they have extremely limited number of private rooms, whereas hospitals built after 2006 have only private rooms. Many hospitals are currently working towards implementing as many private rooms as possible within the limits of their current architectural design. Others are tearing down buildings in order to open new hospital wings and have private patient rooms. Much time, money, and effort are being put into the planning and the use of private hospital rooms. The purpose of this study is to determine whether or not the time, money, and effort being put into the new design for private rooms is beneficial to the hospital facility.
Through studying the literature and analyzing the information, we have found an answer to our research question: Does private room occupancy have any effect on the overall wellness of patients? The research clearly proves that private hospital rooms indeed have an effect on the overall wellness of patients. More specifically, there are many positive effects on the patients, including the decreased risk of nosocomial infection, increased privacy, family presence, and overall increase in patient satisfaction. Despite the few shortcomings of private rooms that the research presents, the benefits of having private rooms far outweigh the negative outcomes. For new hospitals being built, design should include 100% private rooms. Hospitals that are already in use should have at least 50% of their own rooms as private. If it is not currently possible to make the switch to private rooms, the hospital should make an effort to at least allow their patients their own bathroom. These recommendations support our research question that private hospital rooms are the future for hospital stays and will facilitate a positive effect on the overall patient wellness.
Hello. Hi, Michelle.
Hi,
How are you today?
I feel a little okay.
You feel okay? Excuse me, sir. Oh, you brought your dog.
Yeah,
He's barking. My goodness.
Cinch. What's
Well,
his name?
oh no.
He keeps trying to lick my dressing. Is that bad?
That's bad. Out, dog, out.
Oh, he's been licking it.
My goodness. And this loud music, it's very hard when you have two patients in one room, isn't it? Well,
Yeah.
let me just take a look. Excuse me. Got some loud music. Okay. I'm just gonna I'm just gonna look at your wound here, but 1 second. I'm gonna give you this cloth.
Thanks. I do feel really hot. I didn't feel like this. I just had a burn and now I feel really hot. Like I have a fever.
You think you have a fever? Well, maybe that'll bring it down. Here, I'm just gonna put some gloves on.
Oh, okay. Think you just spit on me. And my dressing, is that bad? Oh, do you need this?
What is this? This is your wound. Okay, we're just gonna take a little look-see. Wow, whoever put this dressing on must have been a really good nurse.
Yeah.
Well, it looks like she put some cream on there that is helping it get all better. But I'm just gonna put on this comfort strip. I think maybe there's a yeast bacteria growing in this
Oh dear.
burn.
Dear. Shh. I didn't really want to talk about it in front of this really hot cowboy, but I do feel like I'm getting a yeast infection.
You do? Wow, yeast that grows in the vaginal orifices can be very smelly and painful.
I'm sorry. I really rather not talk about this out loud, but
Sometimes you just have to talk about things in front of others when you have community dual rooms, non-private, semi-private rooms. That's one of the downfalls. But it's okay. Everybody understands that you're in the hospital, and if it's because of a vaginal infection, if it's for a burn or both, you just have to talk about those things out loud. Over loud music with dogs and people right next to you. Don't be sad. Get glad. Okay, man. If you need anything, just let me know later.
okay.
Bye.
Sedge? Come in. Hi, Megan.
Hello, Michelle. How are you today?
Good.
Let me just clean my hands here. I just wanted to come check on you and maybe do a little dressing change on your burn there.
Yeah, I'm glad. I'm glad that you're using hand sanitizer. At my old hospital, they didn't use any hand sanitizer between me or my patient.
They didn't? How did that work out?
Well, there was a patient right next to me, and the nurse definitely didn't wash her hands, and neither did the doctor because we were so close together. I guess they just assumed they could just hop right over.
Well, that is too bad, but now that you're in this wonderful private room, I am able to clean my hands when I walk in the door and when I leave.
Wonderful. I'm reading this book, awesome book called Evidence-Based Practice Nursing, and I'm learning a lot of new things about hospital-acquired infections.
Can you give me an example of something that you've learned?
Sure. For example, I learned that if I'm in a single room, like this one, from the Better Hospital, I will have 50% less chance of getting a yeast infection.
Oh, wow. That's very true.
Yeah.
If you go through some more research-based practices, you would find an article by Telsch, who also would reiterate the fact that your chances of getting a bacteria infection decrease by 50% when you're in a private room.
Yeah, that's good, because I really don't like yeast infections.
Yeah, it's pretty bad.
Yeah.
But I'm glad that you're at a hospital that has private rooms.
I know. I really actually did some research in this awesome book and discovered that as of a couple years ago, they made all hospitals, new hospitals, have to have private rooms.
That is true. In 2006,
Was it 2006?
It was 2006. They created a new law that said all new build hospitals have to be private rooms only. Isn't that great?
It is wonderful because I left worse than I did before. It was the worst nightmare ever.
Well, I'm glad that you're here and that we could
Thank
take
you.
care of you privately. So I heard you were a little toasty, so I brought you this cool washcloth
Thank
to
you.
put on your forehead.
Thank you.
Doesn't that feel good?
Oh, yes.
Okay, now let me just put some gloves on here. And I'm just going to take a look at your burn.
Yeah, I think it's...
Wow, look at that burn. It's got some interesting lines on it. Okay, so what I'm going to do first here is I'm just going to clean that off just so we can make sure it's not getting any extra bacteria. And then I'm going to get some nice cream to put on it. This is nice little medicated cream. I'm just going to put it right on the wound.
Thank you. It kind of hurts.
It hurts. On a scale of 1 to 10, what would you say your pain is?
I would probably say it was a 7. When it happened, it was a 10.
Oh, wow. Well, at least it's decreasing.
Yeah.
We're going to use these nice Johnson & Johnson Steri pads
Yes.
to cover up this so that your cream doesn't come off.
I think just because I'm in a single room, I feel a lot more calm, and my pain is actually decreased.
Yeah, and it's very quiet in here. Isn't that nice?
Yeah, it is much quieter than my last experience.
Yeah. Do you have any family that's going to come visit?
Yeah, I have one daughter and one son that's going to come visit. Hopefully they don't bring any of their family.
Well, that's good. At least you'll have some family here and you guys can visit in private. And you guys can talk about your medical condition without others listening to you and hearing what's wrong with you, because
Yeah.
that's some private matters.
In my last hospital, when I had my yeast infection, I had to talk about it when there was this handsome young chap right next to me.
And that can be very embarrassing, can't it?
He was a cowboy.
He was.
Yeah, and I was very embarrassed because I had to say I had a yeast infection right in front of everybody.
Well, see, that is one of the major benefits of being in a private room, because you can talk about all of your embarrassing problems without being embarrassed because nobody else can hear you.
I really appreciate that.
I appreciate you being such a wonderful patient, and I'm going to let you be here. But if
Thank
you need
you.
anything, just press your call light. And if you need to make any phone calls, there's a phone right here for you, and you can have private conversations without anybody hearing what you're saying.
Oh, it's such a relief to be in a private room, Megan. Thank you so much for being such a great nurse.
Thank you, Michelle. If you need anything, you just press your button.
All right, thank you.